Good day, I am Sheila Marie de la Cruz from BSN 2B. For today's return demonstration, I will be doing the pap smear test. Before the procedure, make sure to check the doctor's order, perform hand hygiene or hand washing, then provide privacy and comfort to the patient. Introduce yourself to the patient. Identify the patient by the two identifiers, which are the name and birthday. Hi ma'am, I am Sheila Marie de la Cruz, your nursing assistant for today. But first, will you please state your name and birthday for me, please? Okay, thank you, Ms. Santos. Then, explain the procedure to the patient. Make sure that the patient does not have her monthly period, and be sure that the client has not have a sexual intercourse for 3 days. For today, we're going to conduct a pap smear test. We're going to look for your cervix to look for signs of infection. So, is it okay with you?
Yes, ma'am.
Okay, thank you. Ms. Santos, just to make sure, I just want to ask, you don't have your monthly period for this day, right? Thank you, Ms. Santos. Also, you can ask the patient to empty her bladder before the procedure. Also, if you'd like to go to the bathroom to empty your bladder, please do so. No, thank you. Okay. Then, assist the patient to lie on her back or instruct the patient to lie on her back on a dorsal lithotomy position. Now, let me assist you to be in a dorsal lithotomy position. So, let's assume that Ms. Santos is on a dorsal lithotomy position. Then, let me drape the patient, exposing only the pelvic area. Then, wear a clean pair of gloves. And most importantly, wash the speculum with warm water, lubricate, then insert the speculum to the patient's vagina. Now we're going to get an endocervical specimen. To do that, get a sterile cotton tip applicator. Then, wet with saline. Let's assume that this is my saline. Then, insert this onto the speculum to the OS of the cervix. Gently rotate, first clockwise and counterclockwise. Then remove the cotton tip applicator. Smear it to the glass slide, making it as thin as possible. Then spray with fixative. Let's assume this is my fixative. Spray it about 8 to 10 inches away from the glass slide. Then set this aside. Now for the cervical OS specimen. Get a cervical spatula. Let's assume this is my cervical spatula. Insert this onto the speculum. Insert the uneven side of the spatula onto the OS of the cervix. Gently rotate. That's the cervix. Then remove. Carefully not touching the side of the vagina. Then, smear it onto another glass slide, making it as thin as possible. Then again, spray with a fixative. For the last specimen, the vaginal pool specimen, we are using a sterile cotton tip applicator. Then, insert this onto the speculum and roll gently on the posterior fornix just below the cervix, which is also known as the vaginal pool, which is on that part. Then roll it gently. Then remove without touching the side of the vagina. Then again, smear it onto the third glass slide, making it as thin as possible. Then spray with fixative. So that is how we get the 3 specimen: endocervical, cervical OS, and vaginal pool specimen.